First, I would like to say a small word that I believe that healthcare is transforming more from invasive to minimum invasive to non-invasive treatment whenever feasible. And one of the main healthcare medical treatment modalities that are considered completely non-invasive is focused ultrasound. And it's to my great pleasure and honor actually to collaborate for the first time here with the Focused Ultrasound Society, where I touched base with since 6 months, and now we're starting collaborating to be in partnership this year in this session, and next year we are going to partner in the whole conference. So this is a new, I believe it's considered a big step in starting to implement focused ultrasound therapy all over different arms of treatment in the body, using focused ultrasound with the aid and the support of FUS Foundation. I would like to welcome our dear chairman for taking their time to come and attend this session. And we're going to start with Professor Emily White. Professor Emily White is the Managing Director, Operations and FUS Partners. She's FUS Foundation, and she was a great support actually with the liaison communication with the FUS Foundation, and she's going to give us a presentation on ultrasound therapy field 2022.
Good afternoon. I'm thrilled to be here and a part of the therapeutic ultrasound session. Before we get started, I want to say a special thank you to Dr. Mohammed Fazi and the conference organizers for the opportunity to speak with you today. I know it takes an entire team working very long hours to pull off such a successful conference like this, and I appreciate all the magic that happens in the background to make it so. All of the materials I am about to present today, I am happy to share with anyone in the audience. My contact information will be on the last slide, and I encourage any and all of you to reach out to me directly. My name is Emily White, and I am the Managing Director of the Focused Ultrasound Foundation. In addition to running the day-to-day operations of the organization, I spend a lot of my time talking directly with the manufacturers of the technology, talking with the leading research sites around the world making new discoveries in the field, and taking the annual pulse of the ecosystem through our annual survey and publication of the State of the Field report. By training, I'm a surgical oncologist. I did both my residency and fellowship at the University of Virginia. I've known our CEO, Dr. Neil Cassell, for over 25 years. When I was a medical student, he was the chair of neurosurgery, and he continued as the chair of neurosurgery until he retired in 2012. In 2013, when I left clinical medicine, I had 2 startup companies before joining the foundation in 2016. The Focused Ultrasound Foundation is a unique medical research, education, and advocacy organization that serves as the catalyst for the development and adoption of focused ultrasound. The foundation has become a model of how philanthropic funding can be used to bridge the gap between laboratory research and widespread patient treatment. Maury Bloomfeld, one of the pioneers in the development of MR scanning, said that if an organization like the Foundation had existed in the early days of MRI development, it would have taken years off of the time it took for MR scanning to become a mainstream diagnostic technology. While the foundation that I work for is located in Charlottesville, Virginia, we say focused ultrasound technology is global, and so are we. And so while everyone was on lockdown during the global pandemic, we created 2 additional foundations, both one in the United Kingdom and one in Hong Kong. So that way we can spread our geographical reach. Our vision and mission is simple. We want to improve lives and reduce suffering. And to do this, we want to accelerate the development and adoption of focused ultrasound as a global standard of care in the shortest time possible. We think it's a big idea and a compelling story, and that saving lives is a noble cause. Before we jump into the heart of this talk, I want to take a minute to just level set. The use of energy to treat disease instead of or as a complement to the use of chemicals or drugs to treat disease is not a particularly new or novel idea. It's been around for a long time. The individuals in the room today not only have heard of all of these energy types listed on the screen, but have probably used them in clinical practice on a routine and if not daily basis. Historically, ultrasound has served as a diagnostic and imaging tool, but it has the potential as a much greater impact on people's lives when used as an actual therapy. Focused ultrasound is an early-stage revolutionary non-invasive therapeutic technology. We've seen it used both as an alternative or a complement to surgery, radiation, drug delivery, and immunotherapy. We think it has the potential to transform treatment. Focused ultrasound is a non-invasive therapeutic technology. Patients can be treated in an outpatient setting. There are no incisions, so there are less pain. There are also decreased complications from infection, hemorrhage, or collateral tissue damage. Patients generally recover rapidly, and we've seen improved outcomes at a lower cost. Focused ultrasound is analogous to a magnifying glass. Just as you would use a magnifying glass to burn a hole in a leaf, you can use ultrasound beams to create a bioeffect in a human body. So how does FUS actually work? Using either various modes of imaging, MR, ultrasound, X-ray, you can use image fusion, stereotactic tools. A physician can precisely target with sub-millimeter accuracy a spot in the body. Then the physician generates ultrasound waves with the use of focused ultrasound equipment targeted at the predefined spot. Each individual ultrasound beam passes harmlessly through the tissue to the location in the body. But at the point of convergence, there are profound effects such as tissue destruction. The four colors in this graphic reflect the four types of sound waves we typically see in focused ultrasound. The high amplitude waves in the yellow represent histotripsy, and this elicits a mechanical effect on the cells, resulting in cell death. The green waves represent hyperthermia, or gentle heating of the tissue. And the purple wave represents thermal ablation, basically cooking the tissue like we saw with the magnifying glass and the leaf. And then the light blue lines represent a very generic category called non-thermal, which I will discuss later on. While I know this is a very busy slide, internally we often refer to it as the spiderweb slide. There's no expectation that you're going to absorb it all in the time that I have it on the screen. What I want the audience to glean from it is this. By just merely adjusting the waveform of the sound energy, the colored circles here represent the waveforms you just saw on the previous slide, you can create a tremendous number of different biological effects in the body. And some of those effects can be created by different waveforms. Well, here is a comprehensive list of the biomechanisms. I'm not going to go into detail because the talks during the rest of this entire session will highlight the incredible impact this technology is having on treating disease. We have seen this technology used for the delivery of both drug and biologics in very precise locations in the body in both the preclinical and clinical trial research space. One mechanism of action of particular interest to the research community is the opening of the blood-brain barrier. We know that we can safely and temporarily open the blood-brain barrier. There are close to 100 clinical trials around the globe now doing exactly this for various patient populations, including patients with glioblastoma, DIPG, or diffuse midline glioma, if that's the phrase you're using these days, Parkinson's disease, Alzheimer's disease, ALS, and others. Dr. Wadi Gadroit is giving a talk later on in the session today, I believe, and so I don't want to steal his thunder. But he will talk to you more specifically about focused ultrasound in the brain, both for drug delivery, gene therapy, and thermal ablation for movement disorders. I'm going to switch gears here a little bit, and I want to take just a couple of minutes to talk about the greater focused ultrasound community. The data in this chart is derived from the annual survey that the Foundation sends out every year to research and treatment sites around the world. If anything, it's an underrepresentation of the statistics because we may have identified all of the sites and or a site might not return our survey. But even so, you can see that there are nearly 900 commercial treatment sites around the globe, vast majority in Asia, Europe, and North America. Same goes for clinical research at 242 sites around the globe, preclinical research around 150, in particular mechanisms of action. Again, this is how we use those ultrasound effects to create biological change in the body. And then lastly, technical research, so development of the actual hardware and or software for the therapy. This slide represents a snapshot of the global development landscape. With over 170 indications currently in the pipeline, we see this field spread across just about every single body system. While the majority of the practitioners using focused ultrasound in their practice today include radiologists, urologists, OB/GYN doctors, neurosurgeons, and general surgeons, we do believe that it will expand well beyond those fields into oncologists, cardiologists, and the like. On this graph, the number of indications is along the y-axis, and along the x-axis is time. The yellow line represents clinical trial or first-in-human studies, and the green line represents preclinical stage research. As you can see, in early 2017, those two lines crossed. It was really the explosion of the industry and the transition from if this technology will work to when will it become clinically adopted. To date, about 500,000 people have been treated with focused ultrasound. 38% have been treated for uterine fibroids, 21% for liver tumors, 20% for prostate disease, and 10% for pancreatic cancer. If you look at the graphic on the right-hand side, the annual patient treatments, this is all indications. But if you notice in 2017, we were seeing about 20,000 patients treated a year. And last year in 2021, we saw nearly 100,000. That's a 5-fold increase. So that's just a really good indicator of how fast the field is growing. There are 32 indications with approval worldwide. 30 in Asia, 27 in Europe, 8 in North America, 12 in South America, 12 in Oceania, and just 1 in Africa. I want to make a special note of the fact that while there are only 32 diseases that have regulatory approval, there are 35 regulatory agencies that have granted approval, and there are actually 289 unique approvals. In addition to uterine fibroids, liver tumors, prostate tumors, and pancreatic tumors, other indications that are approved of note include things like thyroid nodules, arthritis, bone tumors, soft tissue tumors, glaucoma, depression, OCD, and some of the neurodegenerative diseases like essential tremor, Parkinson's disease, tremor, and dyskinesia. To date, there have been over 65,000 publications in focused ultrasound with nearly 185,000 citations. Last year in 2021, there were over 600 publications and almost 25,000 citations. As you can see from the graphic on the right, the majority of these publications are in journals related to surgery, radiology, oncology, neuroscience, and neurology. Focused ultrasound is where MR imaging was 25 or 30 years ago in its evolution. At that time, MR was unknown, but today everyone has either had an MR scan or knows somebody who has had one, and MR has revolutionized diagnosis. Focused ultrasound has the potential to revolutionize therapy to the same degree that MR has revolutionized diagnosis, but it's early stage. Although in its infancy, focused ultrasound is real today. The following examples demonstrate its potential. This is a local architect here in town who was one of the first patients treated in our essential tremor clinical trial at the University of Virginia. He had a pronounced tremor, and he was not only unable to continue his work as an architect, but his tremor was interfering with typical everyday activities and normal motor function. After his treatment with focused ultrasound, his tremor was reduced and both his work and personal life were greatly improved, again, without invasive surgery. These are images of a 60-year-old Italian surgeon with stage 4 pancreatic cancer who opted to undergo focused ultrasound treatment for pain palliation and for the relief of some obstructive symptoms. The primary tumor volume was reduced by 50% on the day of the procedure. 22 months later, his cancer has not regrown, and some of the peripheral lymphadenopathy is resolved, indicating that not only did the focused ultrasound thermally ablate the tissue targeted, but somehow there were associated systemic immunomodulatory effects. The role of focused ultrasound for enhancement of cancer immunotherapy is a current hotspot of research, and you'll hear about this later on this afternoon from Dr. David Brennan. This is a 15-year-old right-handed lacrosse player who received off-label compassionate use focused ultrasound. No surgeon wanted to operate on this tumor for fear of partial permanent loss of function. The patient was treated with focused ultrasound with no loss of function and is back out on the lacrosse field. This is a case of a 6-year-old girl with an abdominal tumor. Her ureters were completely compressed and she was struggling with kidney failure issues as a result. Surgeons tried to operate, but it was too bloody, and so they had to back out. Again, a compassionate use for focused ultrasound. They were able to ablate 60% of the tumor using focused ultrasound, and the patient started producing urine within a few hours. A few days later, the surgeons were able to go in and resect the remainder of the tumor. The child is alive and well with perfectly functioning kidneys. Using focused ultrasound to treat varicose veins is an indication approved in the last year or two. As a resident, I did many cases of vein stripping, and my sister, who's an interventional radiologist, does the foam injection treatment. Using focused ultrasound is completely non-invasive, and the vascular surgeons in Europe, where this is approved, are quite pleased with the outcomes and patient experience. I expect we will see rapid commercialization and expansion in this area in the next few years. When I started at the foundation, there were less than 10 focused ultrasound companies in the ecosystem. Now there are over 65. In fact, I was just at another focused ultrasound conference in Washington, D.C. this past week, and I had 3 individuals approach me stating they were starting a company and wanted a bit of my time to discuss their company ideas. These companies are distributed all over the globe with roughly equal numbers in Asia, Europe, and the United States. The vast majority are all early stage research and development. About 15 have products for sale in some markets somewhere in the globe, and 4 are publicly traded. A few years ago, I started tracking investment dollars entering the field. It's been very consistent, several hundred million per year. As you can see, 2021 numbers were nearly 400 million, and 2022 is tracking similarly despite the economic downturn. People always ask me what the equipment looks like. These photos are representative of a few of the machines that are currently on the market. As you can see, they range in size. The Profound MR guided system is what Dr. Fawzi uses for his focused ultrasound cases. The ultrasound guided systems for prostate seen here for Sonicare and EDAP, and the Thoracleon soft tissue machine for thyroid and breast are similar in size to a typical ultrasound diagnostic machine with a robotic arm attachment. And then we have the very small iTech Care disposable transducer that is used for glaucoma and fits on the eyeball. The size and configuration of the focal point depends on the transducer configuration and sonication parameters. Focal points can be clustered together to tailor treatment for a large lesion or custom designed through the treatment planning software for irregularly shaped lesions and/or lesions in difficult to treat locations. This slide demonstrates the sharp margin between the treated and untreated tissue that can be achieved with focused ultrasound, approximately 0.1 millimeters. The margin is infinitely sharper than can be achieved with radiation and sharper than I was ever able to achieve with a scalpel in the operating room. In summary, here are the reasons why I think focused ultrasound is a unique therapy. It's repeatable, it's non-invasive procedure with less pain and fewer side effects. The outcome is immediate, and it's better than the standard of care and potentially at a lower cost. This technology is a platform, it's not a product. It can treat multiple diseases through multiple mechanisms of action. Focused ultrasound can be a solution to critical unmet clinical needs for certain diseases and indications. And again, it's an alternative or a complement therapy disrupting the current treatment paradigm. Focused ultrasound. It's the most powerful sound you will never hear, but it is the sound that could one day save your life.
Thank you. It's recorded.